Hi, my friends, my family, my fans. How are ya doing? I'm Andrew Ditch. I am diagnosed with autism and intellectual disability. Today's video starts a series on sensory processing disability and how it affects the everyday life of being autistic. I will go into 5 primary senses and 3 secondary senses you may not have heard about. Proprioception is the body's ability to sense its position and movement in space, playing a crucial role in balance, coordination, and overall physical awareness. Before I dive into the proprioception, I want to explain some of the many things that I personally deal with struggles with proprioception. Climbing stairs is hard and not safe without supervision and supports. I get dizzy when walking on stairs and when climbing a ladder. I see open space around me and my body gets disoriented. Handwriting is hard for me. Holding on everyday objects like washcloth, baby wipes, pens, fork, and others, I have a hard time not knowing how much pressure I need to use to grip it. I drop things. I have a hard time with wiping and washing my body. I have a hard time with putting too much pressure when washing sensitive parts or not enough pressure, making my personal hygiene not effective. Using an oven is not safe for me. I have made several videos of cooking and climbing stairs to demonstrate the safety issues. Lastly, I have one more thing. When I walk, I pound my feet, and I am not quiet. Yes, having a spine injury makes this harder as my feet are not able to toe walk without my heel dropping. This is my spine injury. Having autism makes this much harder. I almost forgot crossing the street is very unsafe for me, especially with not being able to sense where cars around me. Walking on snow or ice or uneven grounds makes a risk of injury. I find rocking, swinging, weighted blankets, vibrators, hugging my weighted stuffed animal, bear hugs, and shoulder squeezes very helpful for me. What is proprioception? Proprioception, often referred to as the sixth sense, is the body's internal sense that allows individuals to perceive the position and movement of their limbs without relying on visual input. It is a critical component of the somatosensory system, which includes various sensory modalities such as touch, temperature, and pain. Proprioception helps us perform everyday tasks, from walking and running to writing and playing sports, by providing continuous feedback about our body's position and movement. How does proprioception work? Proprioception relies on specialized sensory receptors located in muscles, tendons, and joints. These receptors, known as mechanoreceptors, detect changes in muscle length, tension, and joint position. When these receptors are activated, they send signals to the central nervous system, CNS, which processes the information and helps coordinate movement. Importance of proprioception. Movement coordination. Proprioception allows for smooth and coordinated movements, enabling individuals to perform tasks without needing to look at their limbs. For example, it helps a person catch a ball or navigate through a crowded space without colliding with others. Balance and stability. This sensory system is essential for maintaining balance and posture. It helps the body adjust to changes in position and movement, reducing the risk of falls and injuries. Force regulation. Proprioception enables individuals to gauge how much force to apply when lifting objects, ensuring that they do not exert too much or too little effort. Proprioception and autism. Proprioception, the body's internal sense of position and movement, is often disrupted in autistic individuals, affecting coordination and emotional regulation. Sensory integration strategies, including proprioceptive input, can improve focus, reduce anxiety, and support motor skills in children with autism. Occupational therapy and ABA therapy can incorporate proprioceptive activities to help children develop better body awareness and coping skills. Above and beyond ABA therapy. Proprioception and autism. A deeper dive into the link. Discover the link between proprioception and autism. Explore challenges, activities, therapy, and more. Unravel the power of sensory integration. Updated on July 15th, 2025. By Ralph Mahler. Understanding proprioception in autism. Proprioception, also known as kinesthesia, is the internal awareness of the body's position, movement, and spatial orientation. It plays a significant role in self-regulation, coordination, posture, body awareness, focus, and speech. Proprioceptive input provides vital information to the brain about the body's position in space, movement of body parts, and the required muscle strength. This input is received from sensory receptors in the skin, muscles, and joints. Definition and importance of proprioception. Proprioception is a sense that tells us where our bodies are in relation to other objects and in open spaces, as well as how our different body parts are moving. It allows us to perform everyday tasks such as walking, riding, and reaching for objects with precision and coordination. The importance of proprioception in daily functioning cannot be overstated. It provides the foundational awareness needed for motor skills development and coordination. Proprioceptive feedback helps individuals determine how much force and pressure to exert in activities like cracking open an egg without crushing it. Without proprioception, these tasks would be challenging and imprecise. For individuals on the autism spectrum, proprioception may play an even more vital role. Many students with autism seek proprioceptive input to regulate their emotional and behavioral responses to sensory stimulation. Proprioceptive input can be calming for those who are easily overwhelmed by sensory stimulation, while for others, it can provide the necessary alertness and sensory stimulation to facilitate attention and learning. Impact of proprioceptive dysfunction. Some individuals on the autism spectrum may experience differences related to proprioception. Proprioceptive dysfunction can manifest in two main ways: oversensitivity and underresponsiveness to proprioceptive input. Oversensitivity to proprioception. Some individuals with autism may be oversensitive to proprioceptive input. This means they may find certain movements, body positions, or pressure uncomfortable or overwhelming. They may have difficulty modulating their movements and struggle with tasks that require them to regulate force or pressure that underresponsiveness to proprioception. On the other hand, some individuals with autism may be underresponsive to proprioceptive input. They may seek out intense or repetitive movements, apply excessive pressure, or engage in self-stimulatory behaviors to obtain the sensory input they require. Understanding the impact of proprioceptive dysfunction in autism is crucial for developing appropriate strategies and interventions to support individuals with autism in their daily lives. In the following sections, we will explore proprioceptive activities, occupational therapy approaches, and assessments designed to address proprioceptive difficulties in individuals with autism. Proprioception challenges in autism. Individuals with autism often experience challenges related to proprioception, which is the awareness of one's body position and movement in space. These challenges can manifest as oversensitivity or underresponsiveness to proprioceptive input. Oversensitivity to proprioception. Some individuals with autism may be oversensitive to proprioceptive input. This means that they may have heightened awareness and sensitivity to the sensations of their own body movements. As a result, they may find certain movements, positions, or activities uncomfortable or overwhelming. They may exhibit behaviors such as avoiding certain movements or activities, becoming easily agitated or anxious in response to proprioceptive input, or showing a preference for sedentary activities. To support individuals who are oversensitive to proprioception, it is important to provide calming strategies and activities that help them regulate their sensory experiences. These strategies may include deep pressure activities like firm hugs, using weighted items such as heavy blankets or backpacks, or engaging in activities that provide a sense of compression or resistance. These activities can help individuals with autism achieve a calm and alert state, which improves emotional well-being and their ability to engage and learn. Underresponsiveness to proprioception. Conversely, some individuals with autism may be underresponsive to proprioceptive input. This means that they may have a reduced awareness or difficulty processing proprioceptive sensations. They may seek more sensory input to compensate for this underresponsiveness. This can manifest as engaging in activities that provide deep pressure, such as banging objects, jumping, stomping when walking, or biting/sucking on fingers. They may also enjoy wearing tight clothing or using weighted items like heavy blankets or bags. To address under-responsiveness to proprioception, it can be beneficial to provide stimulating activities that offer deep pressure or intense sensory input. These activities can help individuals with autism increase their awareness of their body and movement. Occupational therapists can provide guidance on suitable proprioceptive equipment and tools, such as weighted backpacks or other sensory items, to help individuals manage these challenges. Understanding and addressing these proprioception challenges in individuals with autism is important for their overall sensory processing and well-being. Occupational therapists play a significant role in providing therapeutic interventions and strategies to support individuals with autism in managing their proprioceptive difficulties. By implementing appropriate sensory integration techniques, individuals with autism can improve their attention, awareness, and overall regulation of sensory experiences. Assessments such as the Comprehensive Observations of Proprioception (COP) scale can also be used to evaluate proprioceptive difficulties in children with autism, providing valuable insights for intervention strategies. Proprioceptive activities for children with autism. Engaging in specific proprioceptive activities can greatly benefit children with autism by providing them with sensory input that helps them regulate their bodies and emotions. These activities can be categorized into calming strategies for oversensitive individuals and stimulating activities for under-responsive individuals. Calming strategies for oversensitive individuals. Children who are oversensitive to proprioception may exhibit heightened responses to sensory input. They may be easily overwhelmed or anxious in certain situations. Calming strategies that provide deep pressure input can help these individuals feel more grounded and regulated. Some effective calming proprioceptive activities include deep pressure hugs. Giving or receiving firm, deep pressure hugs can provide a calming effect and promote relaxation. Weighted objects. Using weighted items such as blankets, vests, or lap pads can provide a comforting and calming sensation. These items apply gentle, evenly distributed pressure to the body, helping to soothe and reduce anxiety. Pushing or pulling activities. Engaging in activities that involve pushing or pulling heavy objects, such as furniture or weighted carts, can provide deep pressure input and help regulate the nervous system. Compression garments. Wearing compression garments, like snug-fitting clothing or compression vests, can provide a gentle, consistent pressure that promotes a sense of calm. Yoga or deep pressure exercises. Practicing yoga poses or engaging in deep pressure exercises, such as wall push-ups or bear hugs against a cushioned surface, can provide calming proprioceptive input. Stimulating activities for under-responsive individuals. Children who are under-responsive to proprioception may seek additional sensory input to feel more grounded and connected to their bodies. Engaging in stimulating activities that provide intense proprioceptive input can help these individuals become more alert and focused. Some stimulating proprioceptive activities include jumping or bouncing. Activities that involve jumping on a trampoline, bouncing on an exercise ball, or engaging in jumping jacks can provide intense proprioceptive input and increase alertness. Heavy work activities. Encouraging tasks that require pushing, pulling, or carrying heavy objects, such as moving furniture or carrying weighted bags, can stimulate the proprioceptive system and increase engagement. Obstacle courses. Setting up obstacle courses that involve crawling, climbing, jumping, and navigating through various sensory elements can provide a combination of proprioceptive and other sensory input, promoting alertness and coordination. Resistance exercises. Engaging in resistance exercises, such as using resistance bands or pushing against a wall, can provide deep pressure and proprioceptive input to the muscles and joints. Sensory swings or hammocks. Using sensory swings or hammocks that provide a cocoon-like sensation can offer calming and stimulating proprioceptive input. Simultaneously, by incorporating these proprioceptive activities into daily routines, children with autism can benefit from enhanced regulation, improved focus, and increased body awareness. It is essential to tailor the activities to each child's specific sensory needs and preferences, ensuring a positive and beneficial experience. For more information on proprioception and autism, refer to our article on proprioception autism examples. Occupational therapy for proprioception. Occupational therapy plays a vital role in addressing proprioceptive difficulties in individuals with autism. Occupational therapists, OTs, are trained professionals who specialize in helping individuals develop the skills necessary for daily activities and improve their overall quality of life. Role of occupational therapists. Occupational therapists play a crucial role in assessing and addressing proprioceptive challenges in individuals with autism. They work closely with individuals to develop personalized strategies and interventions that target specific sensory needs. OTs utilize a variety of techniques and activities to enhance proprioception in individuals with autism. These may include developing sensory diets. OTs create individualized sensory diets that incorporate activities and exercises to provide the necessary proprioceptive input throughout the day. These activities can include heavy muscle work, weight-bearing exercises, pushing, pulling, or carrying heavy objects. By stimulating the proprioceptors and impacting the arousal center of the brain, these activities help individuals maintain an optimal state for learning and focused attention. Proprioceptive equipment and tools. OTs can provide guidance on a wide range of suitable sensory equipment to help manage proprioceptive challenges in individuals with autism. This may include weighted backpacks, compression garments, or specialized tools that offer extra sensory feedback. For example, weighted backpacks can be used to provide additional proprioceptive input when walking, helping individuals feel more grounded and aware of their body movements. Collaborating with other professionals. OTs often collaborate with other professionals, such as speech therapists, physical therapists, and educators, to develop comprehensive intervention plans. This interdisciplinary approach ensures that all aspects of an individual's development and well-being are addressed. Proprioceptive equipment and tools. Proprioceptive equipment and tools can be beneficial in promoting proprioceptive awareness and regulation in individuals with autism. These tools are designed to provide sensory input to the muscles and joints, helping individuals better understand and control their body movements. Some commonly used proprioceptive equipment and tools include equipment/tool. Weighted backpacks can be used to provide extra sensory feedback when walking. The added weight helps individuals feel more grounded and aware of their body movements. Equipment/tool. Compression garments, such as vests or sleeves, provide deep pressure input to the body, which can help individuals feel more secure and regulated. These garments apply gentle pressure to the muscles and joints, promoting body awareness and calming the sensory system. Therapy balls, also known as exercise or stability balls, can be used for various proprioceptive activities. Sitting on a therapy ball engages the core muscles and promotes postural stability. Rolling or bouncing on the ball can provide sensory input to the entire body, enhancing proprioceptive awareness. It's important to note that the selection of proprioceptive equipment and tools should be based on individual needs and preferences. Occupational therapists can provide guidance on the appropriate use of these tools and ensure that they're implemented safely and effectively. By working closely with occupational therapists and utilizing proprioceptive equipment and tools, individuals with autism can gain better control over their movements, improve body awareness, and enhance their overall sensory regulation. Assessing proprioceptive difficulties in autism. Understanding and assessing proprioceptive difficulties in individuals with autism is crucial for developing effective intervention strategies. Two commonly used methods for assessing proprioceptive difficulties in autism are the Comprehensive Observations of Proprioception, COP, scale, and Proprioception Evaluation and Intervention Strategies. Comprehensive Observations of Proprioception, COP, scale. The Comprehensive Observations of Proprioception, COP, scale is a valuable tool for measuring proprioceptive difficulties in children with autism spectrum disorders, ASD. This scale allows clinicians to assess proprioceptive processing by directly observing the child's motor responses and behaviors. The COP scale consists of 18 items that focus on various aspects of motor and behavior regulation related to proprioception. It has demonstrated suitable psychometric properties for both clinical use and research purposes. The scale enables clinicians to comprehensively evaluate proprioceptive processing difficulties and gain insights into the specific challenges faced by individuals with ASD. The COP scale has been used in studies comparing children with ASD to those with developmental disabilities, DD, and has shown significant differences between the groups. These differences are observed in various items, including feedback-related motor planning, tiptoeing, pushing others or objects, and crashing, falling, and running. It is important to note that further research is needed to explore proprioceptive differences among individuals with ASD, their impact on functional behavior and motor skills, and the psychometric properties and clinical utility of the COP scale across diverse clinical populations. Proprioception evaluation and intervention strategies. In addition to using the COP scale, clinicians and therapists employ various evaluation and intervention strategies to address proprioceptive difficulties in individuals with autism. Evaluation strategies involve comprehensive assessments of an individual's proprioceptive functioning. This may include observing their responses to different proprioceptive stimuli, assessing their motor skills and coordination, and identifying specific challenges they face in proprioceptive processing. Based on the evaluation findings, intervention strategies are tailored to address the individual's proprioceptive difficulties. These strategies may involve the use of proprioceptive equipment and tools, such as therapy balls, weighted vests, or balance boards, which can help improve proprioceptive awareness and motor planning. Occupational therapists play a crucial role in evaluating proprioceptive difficulties in individuals with autism and designing appropriate intervention plans. They collaborate with individuals and their families to identify specific goals and develop strategies to enhance proprioceptive processing. By utilizing assessment tools like the COP scale and implementing individualized intervention strategies, clinicians and therapists can gain a deeper understanding of proprioceptive difficulties in individuals with autism and provide targeted support to improve their proprioceptive functioning. Sensory integration and autism. Sensory integration plays a crucial role in the lives of individuals with autism, as it involves the interconnection of various sensory systems. Three primary senses that are integral to sensory integration are tactile, vestibular, and proprioceptive. These senses work together to allow individuals to experience, interpret, and respond to different stimuli in their environment. Dysfunction in sensory integration can lead to challenges in development, information processing, and behavior. Sensory system interconnection. The sensory systems in the body are interconnected, each contributing to an individual's overall perception and understanding of the environment. In the context of autism, sensory integration issues can result in difficulties in processing and responding to sensory information. For example, individuals with autism may experience heightened sensitivity or diminished response to sensory input, such as touch, movement, or sound. Understanding the interconnection between sensory systems is essential in addressing sensory integration challenges in individuals with autism. By identifying and addressing specific sensory processing difficulties, it becomes possible to develop effective intervention strategies and promote better sensory regulation. Sensory integration techniques. Sensory integration techniques are designed to help individuals with autism improve their ability to process and respond to sensory information effectively. These techniques aim to facilitate attention, awareness, and overall arousal regulation. By incorporating sensory activities and exercises, individuals with autism can develop better sensory regulation and participate more fully in their environment. One example of a sensory integration technique is pressure touch, which involves the application of firm and deep pressure to specific parts of the body. This technique has been shown to enhance attention and awareness while reducing overall arousal levels in individuals with autism. Other sensory integration techniques may include activities that provide opportunities for movement, tactile exploration, and auditory stimulation. Occupational therapists play a vital role in assisting individuals with autism in improving sensory integration. Through engaging individuals in various sensory activities and exercises, Occupational therapy aims to enhance neuronal connections in the brains of children with autism. This evidence-based approach focuses on improving sensory regulation and overall participation in the environment. Understanding the interconnection of sensory systems and implementing sensory integration techniques can significantly benefit individuals with autism. By addressing sensory integration challenges, it becomes possible to enhance sensory regulation, promote development, and improve overall quality of life for individuals with autism. For more information on proprioception and specific examples of how it relates to autism, refer to our article on proprioception autism examples. We at Above and Beyond Therapy provide individualized and supportive therapy services at our center, in-home, and at school. References: 1. https://www.occupationaltherapy.com.o/proprioception/. 3. https://middletonautism.com/sensory-strategies/according-to-sense/proprioceptive. 4. https://autism.org/sensory-integration. 5. https://www.ncbi.nih.gov/pmc/articles/pmc 375-4787. If you're interested in disability-related topics, such as treatment, support, accommodations, and rights, like and subscribe for more inclusive content. My next video is on the interoceptive sense. I will talk to you later.